First guest this evening is Dr. Justin Johnson, a urologist with Urology Associates. Welcome.
Thank you.
When we think about men's health, everybody thinks about prostate, and everybody worries about prostate cancer.
Yes.
But there's other diseases of the prostate other than cancer.
Mm-hmm. There are diseases, enlarged prostate, benign prostatic hyperplasia or BPH. There's prostate infections, inflammation, so it'd be prostatitis. Prostate, causes a lot of issues for men, from young age all the way up to older age.
What kind of symptoms might make us think we've got a problem?
Well, typically, for BPH, symptoms, urinary symptoms, it would be a slowing of the stream, maybe going to the bathroom, more frequently, waking up at night, dribbling with urination. Then, as far as prostatitis, you may have some pain in the perineum area, so that's the area under the scrotum. Maybe some low back pain can be referred to the testicles, and along with that, you have some maybe burning with urination.
Okay, well, if you've got BPH, what kind of risk factors? Who's the young guys don't normally get that.
Young guys do not normally get BPH. So as you age, your prostate does continue to grow throughout your life, and your symptoms, will start to slowly show up. It may be that you notice that on a car ride you have to stop, once or twice when you normally didn't. You may start waking up once or twice at night when previously you didn't. You may notice that it takes you longer to urinate. The typical one is, the guys that are in the bathroom at a football game, for example. They noticed a couple people pass, while they're still urinating. So several symptoms, that you may notice, but very nonspecific also.
There's ways to treat that.
Most definitely. Medications, are, changing, as time goes on. We have some pretty good medicines right now that are working. We still have some surgical treatment options, and most of our surgical treatment options, require no hospitalization or one night in the hospital, and that is one of the very few things that in my practice that patients absolutely love. It's the little things we take for granted. Once you get a guy that is not urinating well and now you turn his symptoms around, you make him 35 again, not 25.
Well, 35. Okay, prostate cancer.
Yes.
How do you make the diagnosis? What do you do?
So prostate cancer, can only be diagnosed by tissue biopsy, and we use PSA as a screening test, but we have to remember that PSA is not a cancer test. It's a prostate irritation test. So when that number goes up, it makes us think, okay, there's something is going on inside of the prostate, whether that's infection, inflammation, an enlarged prostate, but it also could represent a cancer. So if the PSA number is trending upward, then we get concerned. At that point, we would be talking about doing a prostate biopsy. It is a mild to moderate invasive test, but it does require tissue diagnosis to get diagnosis of prostate cancer.
Now, you mentioned the PSA. A lot of debate about that,
Yes.
whether you do it or whether you don't do it.
Yeah.
Is it kind of a personal decision, or is there guidelines that you do?
We have specific guidelines. The American Urological Association has changed their guidelines. So anybody below 40, you don't check it. Between 40 to about 55, if you have risk factors, and that's first degree relative African American race. But in general, it's between 55 and 70. Every male should get PSA screening, and the important thing about PSA is you have to realize what PSA is. Like I said, it's an irritation test. So you have to monitor that number with the expectation or realization that it's not a cancer test.
Okay. So if you go, let's say you've got all the symptoms, you get a prostate biopsy, you have prostate cancer, what's the treatment options?
Treatment options include, if it's low grade, low volume, you can do watchful waiting, because prostate cancer does not grow very quickly if it's low grade, low volume. So you can watch the PSA trend, and maybe you do a repeat prostate biopsy in the future to see if that has changed. Otherwise, it's surgery and radiation. Very similar long-term cure rates, different side effect profiles. Me being a surgeon, I'm biased towards surgery, but I think we have great outcomes with that.
Now, there's different types of surgery, robotic versus open?
Most all prostatectomies now are done robotically. Myself and most everyone that I know do those robotically. With that, you have less blood loss, less hospitalization, less postoperative pain. Up front, it is probably a little bit more expensive to your insurance, but as from a global perspective of the time it takes you to get back to work, blood loss, hospitalization time, it is a much better way to go for the patient.
Side effects?
Side effects, for surgery, urinary incontinence at least early on, and that will improve over time. Erectile dysfunction, what I tell my patients is your erections are going to get no better than they are the day I do the surgery. They'll probably get a little bit worse. You give it some time, and if you are wanting an erection, most guys do, I will get you an erection back. It just takes time.
All right. Well, that's great information. We thank you coming in.
Yeah.